There is no pharmaceutical intervention. There is no technology that normalizes this disease. And the effects of these high and variable glucose levels and insulin resistance that accompanies it is cumulative, dose-dependent, and not completely reversible, which means that once you're diagnosed, the clock starts ticking. It just like smoking. The more you do, the earlier you do it, the earlier the impact and the more lost life you probably will get.
And there was a study done with 326 participants that found that the keto diet can increase glycemic control of patients with diabetes. That was in the Precision Nutrition publication. When it says it can increase glycemic control, what does that mean?
So,
is that what we were talking about there?
Yes. So when you do a diet known as the ketogenic diet, you're reducing carbohydrates. Well, when carbohydrates are consumed, they elevate glucose levels. Well, if you dramatically reduce the amount of carbohydrates consumed, you're not having those same type of glucose elevations and fluctuations because you're not consuming the most potent glucose elevating factor in our life, which is carbohydrates. And so when they talk about improvements in glycemic control, it is the measure of 24-hour over multiple day levels of glucose in the circulation and how well is that being controlled within a normal, healthy range.
And so is your goal then to encourage people to restrict carbohydrates in their diet? But, because carbohydrates and sugar have been somewhat, I guess, demonized because you never really hear many good things about sugar. So yeah. What is your goal here? What is the advice to the listener? Is it to restrict their carbohydrates?